modeling here in British Columbia later in the week, and I'm hopeful that when British Columbians see the progress that we have made collectively on flattening the curve, again, we have a few days to go, and Dr. Henry is overseeing that project. I believe that people have cause for genuine celebration and a pat on the back collectively and virtually, I should say, for the work that we've done together to flatten the curve. But we still have more work to do, and therefore the Cabinet today reaffirmed the state of emergency, extending it for another 2 weeks, ensuring that all British Columbians stay the course. We all focus on the task at hand, and that is protecting ourselves, protecting our families, protecting our communities from this scourge of a virus and the pandemic that is seizing the entire world. And it's always useful to remind ourselves that it's not just British Columbia, it's not just Canada, it's not just North America that is gripped by this. It is a global challenge. And therefore, when we look at all of the issues that are before us, we need to do that locally. We need to look at it provincially, and then we need to look across the country and then around the world as we come out from underneath this. I want to acknowledge the good work of public employees here in British Columbia, working with federal officials at our border crossings since we implemented our plan to ensure that every British Columbian returning to BC had a self-isolation plan. 4,700 travelers have come back. They've filled out the appropriate forms, and only 84 of those 4,700 are in quarantine, being supervised by the federal government. Our border plan is working. I'm grateful for the help we've had across the way from local communities, from the Public Health Office, of course, and also the federal government. But the challenges remain, and we need to focus over the next couple of weeks on maintaining the course, ensuring that we're doing everything we can to stay distant from each other, to continue to wash our hands as much as we possibly can, try and not touch your face. Those who are essential to our economy continuing to move, particularly those frontline healthcare workers, again, our thanks. Every night at 7 o'clock, my spouse and I and my neighbours are out banging pots to make some noise for you, and thank you for that that important work that you're doing. We had the local firefighter with his siren going last night, and I hope that it's going to be a regular occurrence. And if you can hear us in Langford, you can hear us in Lanceville, you can hear us right across British Columbia. So with that, I'll happily answer any questions that you may have.
A reminder to reporters on the line, please press *1 to get in the queue and unmute your phones. You won't be audible until we call your name. The first question is from Lisa Yuzda.
Right off the top, lucky me. Premier, looking at how restrictions, distancing measures, limiting access across the province has worked here, and that we're seeing other places across Canada follow suit, do you wish you were not taking more stringent steps sooner, and wondering why that didn't happen, because clearly they're working and other people are following? And also, why did we not procure more materials, raw materials, for doing the testing sooner?
Well, we were leaders in Canada. We identified the challenge here back in January. Other jurisdictions were slower to follow suit. We did procure as much as we possibly could at that time, but we are not the only people in the marketplace. And as you know, with any supply-demand situations, if you're on the wrong side of that request, you may be in a queue before you get the equipment that you need. Our PPE issues were critical. They're starting to resolve themselves. I give thanks to Premier Kenney and the people of Alberta who provided us with 250,000 N95 masks out of their stockpile, and they were also generous enough to help Ontario and Quebec with not just N95s, but also with gowns and other surgical requirements. So we as Canadians are pulling together. There's a joint procurement process being coordinated by the federal government. We have many irons in the fire, whether it be for testing equipment, whether it be for PPE, and we're going to continue to be ahead of that requirement. So far, so good. I take again my guidance from Minister Dix and his very capable team in the Ministry of Health, and we're in a pretty good place today, and I hope that continues.
Our next question is from Justine Hunter.
Oh, hi, Premier. Some money that was approved last month by the legislature was supposed to be for recovery plans, and I'm wondering what signals are you looking at to guide how and when we will begin to ease up on the current pandemic restrictions?
Well, we're looking at a variety of issues across government. Minister Fleming is working with stakeholders in the education system to get the online learning working in every corner of the province. We've seen some really good success, and again, a level of collaboration between educators, superintendents, school board trustees, parents, children, the whole continuum of components of our K-12 system working cooperatively to try and find a way forward through this virtual period, and also having those preliminary discussions about how we would, if the curve continues and we get positive signals from Dr. Henry and the modeling in the weeks ahead, that we would be able to look at bringing kids back to classrooms. But I look at my colleagues across the country who set arbitrary dates for a return before the data was in, before the science was confirming that, and we're not going to follow that lead. We're going to look at the numbers as they emerge over the weeks ahead before we make those determinations. When it comes to other components in the economy, of course, the capacity in our acute care system is robust. That's at the cost of those elective surgeries that we very, very regrettably, Minister Dix and I and the entire government were frustrated that that was a step we had to take, but an important one. And I think that will be a place where we will start to look at moving more people back into our acute care system again when the evidence presents itself, so we can do that. When it comes to other elements of the economy, what we've been trying to do, Justine, is to not shut down everything. There was a lot of talk about lockdown this and lockdown that. Other jurisdictions use that language, and then they publish their exemption lists, which were sometimes pages long. What we've tried to do is make sure that we have safe workplaces, and that's having our WorkSafe minister, our WorkSafe staff, coordinating with public health officials to make sure that we can ensure that work can carry on in British Columbia, whether it be in the construction sector, whether it be in public transit and so on. And we'll be able to start things up, I think, because of our early start to prepare for the pandemic. I think we'll be in a better position when the restart happens. But that's what part of what the Economic Recovery Task Force is talking about weekly with Minister James and Minister Mungal and I, as well as the conversations I'm having with industry leaders, sector by sector, with the environmental community, with the agriculture sector, forestry, and so on, to make sure that all of the stakeholders have an understanding of where we're going, and that when the start up begins, sometime in the not too distant future, again, when the evidence presents itself, I think we'll be in a good place. But we're planning for that and have been planning for it for a number of weeks, making sure that the lines of communication between the players, labor, industry, communities, are as robust as they can be.
Our next question is from Keith Baldry.
Good day, Premier. Vancouver Mayor Kennedy Stewart just wrapped up a news conference, which again he reiterated his need for $200 million or so, roughly, from the provincial government. You've got TransLink saying yesterday they need $75 million a month from both either provincial and federal governments. That's a lot of money. What's your response to a request like this?
Well, certainly I'll start with the City of Vancouver. Municipalities across British Columbia are seeing a decline in their revenues to meet the services that they deliver, or to provide the services that people expect in communities right across the province. And that's a challenge that Minister Robinson has been working on, regular contact with the broader Union of BC Municipalities, the umbrella group, for all municipalities in BC, regional districts and others. But she's also been going mayor by mayor, region by region, hearing people's concerns, hearing their needs, and we're developing proposals that Minister Robinson and Minister James will be talking about later in the week that will be helpful. But again, I don't dismiss Mayor Stewart's concerns, but those concerns are echoed right across the province, and we are still trying to figure out where we go as a province, where our regions need support, what we can ask from the federal government. I had a conversation again, as I do regularly, almost nightly, with Chrystia Freeland. We talked about BC Ferries, public transit, whether it be BC Transit or TransLink. These are vital components of our economy. They may well be public transportation entities. The debate about the state of BC Ferries, is it a Crown corporation or is it a private company? You'll get different answers depending on who you ask on that question. But these are critical components of our economy. We cannot continue to operate even our essential services if we don't have public transportation for our nurses, our care aides, and other providers. So whether they work in retail, in grocery, or other sectors, if we can't get them to work, we will fail. So we're working with the federal government, we're working with TransLink, with BC Transit and the partners within BC Transit to find a way forward. But I think, again, I want to caution all British Columbians, we are making this up as we go, as the problems emerge. The evidence from TransLink yesterday was graphic for the public, and we need to get our heads around that, not just governments and funders, but the traveling public as well. And we need to find those solutions by working together. I'm confident we'll be able to do that.
Our next question is from Rob Buffum.
Hi, Premier. I'm wondering, you expressed sort of optimism about how well we're doing as a province flattening the curve. And I know in terms of restrictions, it sounds like you're not able to weigh in specifically about dates, but in areas where there have been fewer numbers of new cases, like, for example, Vancouver Island, has there been any ongoing consideration of reducing restrictions or easing restrictions in those geographic spots?
Well, that's a very good question, Rob, and we are looking not just at the province as a whole, but the health authorities, whether it be Northern Health, Interior Health, the Island, or Fraser and Coastal Health, because the circumstances within each region are different. Similarly, when you look across the country and you look across North America, circumstances are different, and some of it has to do with weather. I lived for a time in Eastern Canada, and I appreciate how people in winter months are anxious to get south. The spring break was earlier in Ontario and Quebec, which meant more people were traveling, which meant more community transmission was the result. And so we've seen some serious numbers there, particularly in Quebec, that we're not seeing in British Columbia. And that is directly attributable to having a provincial plan at the beginning put in place by Dr. Henry and her team. We followed that meticulously, and we're seeing the benefits of that program. But we're not finished yet, and Dr. Henry will be presenting more data today and detailed modeling on Friday. But the evidence is positive to this point, as you say. Slow growth on Vancouver Island, slow growth in the north, but Interior Health, Coastal Health, and Fraser Health still see an unsettling number of new cases and hospitalizations. We need to manage that, and that's the objectives that Bonnie put forward for us to follow. And it's a credit to all British Columbians who, the vast majority, overwhelming majority, polling numbers. I know media will have access to polling data. Companies are putting it out all the time. The level of support for the initiatives that we're doing here in British Columbia and in other provinces is off the charts. It's just unheard of in our society. We like to disagree as Canadians. We do it pleasantly, we do it politely, but at the end of the day, we've seen almost universal support for these initiatives, and that's the strength of our success, is the strength of people's resilience here to stick with the course, and that's what we intend to do. We may amend as regions dictate, but at this point it's a provincial-wide approach, and that's at the direction of Dr. Henry and the science behind these initiatives.
Next, we have Binder Sajan.
Hi, Premier. I've heard you say several times that the province has the backs of British Columbians who are in need. I spoke with a small business owner who was just starting up his business last week who doesn't qualify for CERB because, in part, his income the previous year wasn't high enough for him to qualify. So then he doesn't qualify for the provincial program either. I'm also speaking to people who are seasonal workers who say that they don't qualify for rental support because they're a few $1,000s over the top end of that. Just wondering, I know you've alluded to more help is on the way. When can we expect to hear more about financial